Welcome to UMCC Medical Consultants Connectors, where your health matters to us. We've all had them, those itchy, red, bumpy patches of skin that drive us crazy. That's a skin rash. They can pop up anywhere on your body, from your face to your toes. Some rashes are just a little annoying, while others can be a sign of something more serious. Rashes happen when your skin gets irritated or inflamed. That can be from a lot of things, like allergies, infections, or even heat. The good news is that most rashes aren't contagious, but they can be super uncomfortable. So let's dive in and learn more about these pesky skin problems. Our skin is pretty tough, but sometimes it gets upset. There are a bunch of things that can cause skin rashes. One of the most common culprits is allergies. Think about that itchy rash you get after touching poison ivy. Yikes! Other common allergens include certain foods, medications, and even pet dander. Next up, we have infections. Bacteria, viruses, and fungi can all cause those itchy red bumps we know as rashes. And let's not forget about irritants. Chemicals, soaps, detergents, and even some fabrics can irritate our skin and lead to a rash. Lastly, sometimes rashes are a symptom of another medical condition, like eczema or psoriasis. These conditions affect the way our skin behaves, making it more prone to rashes. So how do you know if you have a rash? Well, they can look pretty different depending on what's causing them. But some common symptoms include redness, itching, bumps, blisters, dryness, and even pain. Some rashes might be flat, while others are raised or bumpy. And the color can vary too. We're talking red, pink, purple, brown, you name it. The location of the rash can also give us clues about what's going on. For example, a rash on your hands might be caused by an irritant, while a rash all over your body could be a sign of an allergic reaction. Section 4. Figuring out the problem, how doctors diagnose rashes. Diagnosing a rash is like solving a puzzle. Doctors are like detectives, using clues to figure out what's going on. First, they'll ask you about your symptoms and medical history. When did the rash start? What were you doing before it appeared? Do you have any allergies? Have you used any new products lately? Next, they'll examine your skin, checking out the rash's location, size, shape, and color. Sometimes they might even take a small sample of the rash to look at under a microscope. This is called a biopsy. By putting all these clues together, doctors can usually figure out what's causing your rash and recommend the best treatment. Section 5. Making it go away. Treatment options for rashes. Once your doctor knows what's causing your rash, they can recommend the best treatment to soothe your skin and reduce those pesky symptoms. For mild rashes, over-the-counter creams and lotions can be super helpful. These often contain ingredients like hydrocortisone, which can calm inflammation and itching. If your rash is caused by an allergic reaction, your doctor might prescribe antihistamines. These medications block the chemicals that trigger allergic reactions. For more severe cases, your doctor might prescribe stronger medications, like topical or oral corticosteroids. These medications work by reducing inflammation. And of course, if your rash is caused by an infection, your doctor will prescribe the appropriate medication to fight it off. Section 6. Prevention. Keeping your skin happy and healthy. Nobody wants to deal with a rash, so let's talk about prevention. Here are a few tips to keep your skin happy and healthy. First and foremost, know your triggers. If you know you're allergic to certain foods, medications, or materials, try your best to avoid them. Keep your skin clean and moisturized. Use a gentle cleanser and a good moisturizer to keep your skin barrier strong and healthy. Be careful with new products. Before slathering on a new lotion or trying a new detergent, test it on a small area of your skin first to see if you have a reaction. And lastly, try to manage stress. Stress can wreak havoc on our bodies, including our skin. Find healthy ways to manage stress like exercise, yoga, or meditation. UMCC, your ultimate medical consultants connector.